what's happened is that, and I see this all the time in my practice, that people come to me and they have read all the internet and they've seen all the things posted and they're convinced they have such and such diagnosis. And they have become their own doctor. Now, it isn't a bad thing. You should take charge of your own medical care. I mean, I believe in that. You have to take, but it doesn't mean that you're your own doctor, because the internet is not your doctor. Your doctor has gone to school and practiced for many years, and that's why you want to go to a doctor that you trust and have a good assessment and decide with the doctor what the problem is, instead of going anecdotal and finding things that kind of suit what you want. So people find scenarios that they want to be like and they put themselves in that. That is like one scenario. So I think it's very important not to just validate your own self with the internet, but go to the doctor that you trust and have an open mind. Why it's dangerous is because the individual, the patient, doesn't really have the full picture, and they don't have a medical degree, and there's so much that they don't know. And then they think, oh, my friend had this, maybe I have this. And that's why we go to the doctor. And going to the doctor means you have to have a little courage too, because there's a lot of tests and things, and they could find out things maybe that you're not very happy about. So people want to maybe make their own diagnosis. They don't have to go through that pain. But I think if you have some courage, you go to the doctor, really get a good assessment, find out what it is, and you have to deal with it. And a lot of it has to do with the mind-body connection. That people dream about something, part of their body that's not well. And sometimes they could be right. There is a whole mind-body connection. So I'm a good listener. I really want to hear what people had discovered or what they think themselves. Then we're going to do our good assessment, but it may be a good start. So sometimes people can come up with some things and the mind can kind of steer them in the right way. So we shouldn't discount the patient. We should listen to the patient. If you have concerns and you think you have something, go to the doctor, but it doesn't mean that because your friend has this and you read it in the internet that you have this. Actually, you could be relieved to find that you don't have that all along, just because your friend had it, or it's on the internet. There, of course, there's a whole subset of people with hypochondriasis. That's a disorder into itself, but I don't think we're really talking about to that level, but that happens too. So I think the thing to do is, if you have legitimate concerns, go to the doctor, one that you trust, and get a good assessment. First of all, it's really important to find out from people, let's say they are depressed. Find out from people what other people in their family is taking, and listen to the patient. So many patients feel that their doctor doesn't listen to them. They only want to give the patient the medicines that the doctor wanted, not what's good for the patient. So it's very important to listen to the patient, take a good history, and the patients could have some good ideas from other family members that may have had the same illness or medications that worked in their family, and that might be a good start. So it's very important not to self-medicate, and to really allow the doctor and you to have an alliance in helping to find the right medicines and a good regime. A lot of patients have been asking me about hydrochloroquine, and I'm a psychiatrist, and I don't really administer that, but what I tell the patients is, look, you just have to get an informed consent. You go to your doctor, and an informed consent means that you know the risks and the benefits of the medicine, and you sign off on it. That's what we do. It's not complicated, and that's what you should do with your doctor.
BregmanMD Medical Group offers online psychiatry and online therapy.